Okay, what about the surgery and deficiencies? If we do a bypass, we're going to interfere with the digestion and absorption of fat. Good, yeah, cool, right? That's what we wanted. If we do a bypass, we're going to interfere with the digestion and absorption of calories. Also good. We're going to interfere with the digestion and absorption of protein. Maybe not so good, but usually it's not very bad. So we don't have, except in rare cases, protein deficiency. We're going to interfere with the digestion and absorption of iron because iron is very difficult to digest and absorb. We have not seen iron deficiency in our male patients because they don't lose iron on their own. Whereas women during their menstrual cycle lose iron every month and have the potential to lose a lot of iron. It's tough for them to keep up. So in our patients, the most common deficiency that we see is iron deficiency anemia in our female patients, and we almost never see it in our male patients. We see iron deficiency anemia in our female patients in around 5% of patients. And that's pretty high, that's 1 in 20, but it turns out if you look in the general population of young women who are having a menstrual cycle, iron deficiency anemia occurs in 3%. So it's a common problem in the United States because of the loss of iron in the menstrual cycle and the difficulty in absorbing iron, and we make it a little worse because of the bypass. If you want to avoid iron deficiency anemia, taking a little extra iron in your vitamin tablets is what we recommend. But if you still have a large menstrual cycle, we're not going to be able to keep up, and anemia will be in your future. So one of the things you'll want to discuss with your gynecologist and pay attention to is just how much blood you lose every month. And if it's a lot, you'll want to act sooner rather than later to decrease that and talk with your gynecologist. If, on the other hand, your menstrual cycle is relatively light, then maybe you'll never face the problem of the iron deficiency. And so that's not a big deal. If you do get iron deficiency, we're the people to call because we have some pointers and tips, including the first one, which is decrease the monthly cycle loss as the first thing you do. The other thing is that when you take a tablet of iron, the iron is what's called iron sulfate or iron gluconate. And these are iron types that are hard to digest. They're the equivalent of rust on your car. And it turns out your body doesn't digest rust and that kind of iron. The way you really do a good job of digesting iron is when it's wrapped in the hemoglobin type molecule, or what's called heme-bound iron. And that's the way it is in red meat. So that's why red meat tends to be a good choice if you want to avoid and replace iron, if you want to avoid deficiency or replace iron. But a lot of people prefer not to eat red meat, and there's a new kind of over-the-counter tablet which has a heme-bound type iron, and it's called Proferrin, P-R-O-F-E-R-R-I-N, and you get it over the internet, and it is better absorbed. It's been studied in hemodialysis patients who need a lot of blood because they're always getting stuck with needles and their blood is out in a pump every day. So if you wanted to, you could take some Proferrin, but the first thing to do is decrease your menstrual flow. Second thing is Proferrin, and if you get an actual anemia, the best treatment is to talk to us about intravenous iron. And that's the latest on iron in the MGB.
Do you know just by feeling, or do you have to go, because I don't feel bad, so I guess.
One of the early signs is just feeling tired. So if you feel at all tired or weak, even if you don't have any other symptom, you should always get your blood tested for the iron or the ferritin level. And if you feel terrific, you probably don't have any iron deficiency. But every year, whether you feel it or not, you should get it tested.